Hi everyone, and welcome to the lesson on behavioural approach to treating phobias. Before you do this lesson, make sure you've watched the video on behavioural approach to explaining phobias before we do this. So today we're going to be looking at describing how and why two therapies work and explaining the difference between them. We're then going to apply these therapies to explain how you treat real people with phobias, and then we're going to evaluate looking at the strengths and weaknesses of the therapies in terms of their effectiveness and their appropriateness. So the first therapy that we're going to learn about is flooding, and this is a form of behavioural therapy, which both of them will be, that we learn about, and it's to do with treating phobias but also other anxiety disorders. And what happens is that the client is immediately exposed to the thing that they are scared of. So they are put into a room and they are taught beforehand a few breathing techniques and relaxation techniques until they're familiar with them. And then once that happens, they simply place you in the room with the thing that you're scared of. So if you were scared of cats, you would simply be placed into a room with a cat. And you would not leave the room until you feel comfortable enough to interact with the cat and you are not panicking anymore. And this works through counter conditioning, so we're learning a new response in place of an old response. So we're learning in this case to relax instead of to feel anxiety. So we're changing two feelings around. We're removing the anxiety and instead putting in its place relaxation. So we're relearning the response. So when we see a cat next time, we no longer feel anxiety, but instead we feel relaxation, we feel calm. And this works for a process called reciprocal inhibition. And that's the idea that we can't feel scared and relaxed at the same time because they're two opposite feelings. So one has to override the other. And normally when you have a phobia, your fear is overriding your relaxation state. But if we can swap that round, so now you're feeling relaxed, you can't feel scared and relaxed at the same time. So feeling relaxed is put in its place. An example of this would be Miss Ralph is terrified of dogs, and she's taught some breathing techniques, such as visualising a hot, sunny beach that she's laying on. There's sand, there's the sea, you can hear the waves. And while she's thinking of this, and she's feeling very calm, she's put in a room with a dog, and she remembers how calm she feels by laying on the beach with the waves lapping, and that keeps her calm. And Miss Ralph is feeling quite anxious at first, but she's in the room for about 3 hours. She's not allowed to leave. And once she's been in the room for 3 hours, she feels a lot calmer and actually feels so calm that she can stroke the dog. So what's happened here is that she's replaced the feeling of anxiety around dogs and fear around dogs with a state of relaxation, and she feels calm enough to interact with the dogs. So this is our first technique. It's very immediate, it's very abrupt, and it's very quick to do. The second one is different. The second one is systematic desensitization. So you need to have a think about what systematic desensitization is, but also you need to know what the difference is between systematic desensitization and flooding. And one of the main differences is that the pace at which you do it. Flooding is very quick, whereas systematic desensitization may take a number of sessions to help the person get over the phobia. So the very first thing that happens is the patient is taught how to relax, very similar to flooding in this case. They're taught breathing exercises or muscle relaxation, for example, so that they can focus on being calm and being relaxed. Once they've done that, the therapist and the patient construct an anxiety hierarchy. Now that's a key term, so make sure you use the term anxiety hierarchy. And what that is they make a list of the least scary thing to do with that phobia to the most scary thing to do with that phobia. So again, if we're scared of dogs, the least scary thing would just be thinking about a dog. So just thinking about the noises the dog makes or the way the dog looks. And then the second least scary thing would be to look at a picture of a dog, and then maybe to watch a video of a dog. And you work your way up until the person is comfortable with being in a room with a dog, maybe without its lead on. So you look at constructing that anxiety hierarchy together. And it's really important that the therapist and the patient are doing this together, because the therapist can't decide what is the least scary or the most scary for the patient. Only the patient can do that. So the patient needs to be involved in that process of constructing the hierarchy. Once the patient's done that with the help of the therapist, they then go through this hierarchy. So for example, the person might be asked to listen to a dog barking, and they're asked to listen to that whilst practicing their relaxation techniques. So they might do some deep breathing whilst they are hearing the noises of the dog. Now, until the patient feels that they are no longer feeling anxious by hearing this sound, that is when they will move on to the next step. And it's really important that person must feel relaxed before they move on to the next step. If they're not properly relaxed, this process won't work. And I think another side point to mention here is that lots of people think that you might say that you have a phobia of something, like, oh, I'm really scared of, I'm like phobic of spiders, but actually it's a completely different thing. Like for people who are genuinely scared of spiders, like the idea of even walking into a room where you don't know if there's a spider or not is so stressful to you that it's really it's really not possible to cope in that situation. So remember and keep in your mind to do a really basic thing that you think most people wouldn't be scared of if you're creating a hierarchy before you move up to more scary things. For example, someone with a phobia of dogs, we probably wouldn't start by showing them a video of a dog or by putting them in a room with a dog on its lead, because that is really terrifying to those people, whereas they would need a much smaller step first of all, such as hearing the noise of a dog. And then the last thing is that they work their way up through this hierarchy until they reach the top, which might be, for example, having a dog in the same room and stroking it, so that they can move on and achieve, basically not be scared of the animal anymore. So I've just given a quick example. So you might imagine what a spider looks like, look at a photo of a spider, look at a real spider in a glass box, hold the glass box with the spider in, look at the spider on the hand of another person, let the spider crawl onto your shoe, like that. So really, really small steps. Make sure you give several, but if you're giving an example in an exam condition, I might just give the first step, a middle step, and then the last step, and just explain that there would be more in between this because we don't want it to sound like a list. So make sure if you are looking at a question like this, so explain how a hierarchy and relaxation might be used for a treatment of someone, you need to make sure that you are first of all identifying that it's a how. How is the hierarchy used? So make sure you explain how a hierarchy is created, i.e. that it's with the patient and the therapist working together. You're going to apply your knowledge here, even though it doesn't apply your knowledge here to the phobia of wasps. So giving specific examples within the hierarchy, not everything, but giving the first, the middle stage and the last stage. Explain how the client will use the relaxation in this case by giving an example such as deep breathing, and then again apply that to your knowledge of wasps. Make sure it's really clear the distinction between the description of how it works and the applying that to the wasps in order to get the marks. So you might have, as I've said here, explaining what the hierarchy is, applying that to wasps, explaining what relaxation is, and then applying that to wasps again. You might want to pause the video here and just have a quick look at it. So finally, evaluating the strengths and the weaknesses of this therapy, these two therapies. So first of all, research has shown that systematic desensitization is successful for a large range of phobic disorders, i.e. there is supporting research that this therapy works, and that means it increases the validity of the therapy, and therefore it is useful to us because we can show that it has been successful. You could also talk about here the economic implications of this, i.e. it will be positive if there's positive economic implications of the therapy working, because it means people may be able to go back to work who weren't originally able to go back. But also this is quite a cheap therapy as well, so that's another way you can add in economic implications. However, systematic desensitization might not be appropriate for all phobias. For example, like if you have a phobia of, I don't know, lions, then it's not very helpful. Like, you need to be scared of lions, that's helpful. So those phobias are often harder to undo because it's sensible to be scared of them. It's also the opposite to that is that the flooding therapy is actually very traumatic. It's important that you don't say it's unethical. It definitely is ethical because people have given informed consent to do the therapy. But it is traumatic, and it ends up that most people don't go through with it, or they do actually quit and withdraw from it, which we know is really not effective, and it means that some people, it causes more problems down the line by not going through with it. Those who choose flooding, though, do have a higher success rate. So flooding is a more effective therapy than systematic desensitization. So those who do go through with it do have a higher success rate. And both therapies have the problem that sometimes the phobia isn't the issue, but sometimes it's something else. For example, if you're terrified of going outside, so agoraphobia and like socializing with, or social phobia, socializing with people, it actually might be that it isn't anything to do with that, but something else, some other underlying cause that's causing you to have the phobia. And that's a problem because it's hard, therefore, to actually deal with. These behavioural therapies can't deal with an underlying issue, they are just dealing with the phobia. But both therapies are fast and require a lot less effort than other psychotherapies and are, as I've said, are therefore more economically valuable. There are positive economic implications of this. As we've said, it's also worth noting that systematic desensitization is more effective and seen as more successful than flooding. It has higher completion rates and it's less traumatic, and therefore it allows people to make their own progress, so they feel like they're in control of it. So although flooding is seen to have high success rates for those who do it, systematic desensitization is seen as more successful generally. Hopefully that was helpful.